here today at a time when the scale of human suffering and destruction in Gaza is massive and disgusting. And among the most glaring examples of this violence are the deliberate attacks on health infrastructure, including Kamal Adwan Hospital. The human carnage and destruction we've all seen, and I witnessed myself, is the same as Rwanda. However, the tired Israeli strategy used to justify these actions is decades old. Once again, we hear lies from Israeli authorities that hospitals like Kamal Adwan are being improperly used for military purposes by armed groups. These lies are made evidence-free, never substantiated, and are often already debunked. When Israeli officials are feeling less mendacious, they are only flagrantly misleading. It's a familiar script, and it goes something like this. Israeli officials claim that Palestinian resistance fighters are hiding inside a hospital or using the site as a military base to store weapons and launch attacks as part of their freedom struggle against Israel's brutal occupation. In one such evidence-free statement, it released on December 29, 2024, the Israeli military claimed Kamal Adwan Hospital was a, quote, terror stronghold, while also claiming that the Palestinian resistance had violated international law by exploiting civilian infrastructure. Israel has repeatedly invoked similar claims since the bombing of Al-Alhi Hospital on October 17, 2023. Immediately after the Israeli attack on Al-Alhi, Hanania Naftali, the social media advisor to Netanyahu, tweeted that the Israeli Air Force attacked a, quote, terrorist base inside a hospital. A multiple number of terrorists are dead, he claimed about the mostly women and children refugees who were killed, as though it justified such an outrageous breach of human rights. Naftali further claimed, and again, I remind you, this is evidence-free and with no precedent of it being true, that the Palestinian resistance was, quote, launching rockets from hospitals, mosques, schools, and using civilians as human shields. He claimed to be heartbroken over this. Such lies are intended to provide preemptive legal justification for Israeli war crimes. In so doing, the Israeli government is also making racist commentary about the morality of its military versus the supposed barbarism of Palestinians, the natives in this colonial narrative you're supposed to accept. The purpose of those lies is for you to blame the Palestinians themselves for forcing Israel to violate international law to attack these healthcare sites. It is worth noting that consistently, every lie told by the Israeli government going all the way back to 2008, that Palestinian resistance groups are using hospitals as military command centers, have always been disproved and debunked. Multiple investigations, including the 2009 Goldstone report, a 2015 UN fact-finding mission, a 2019 UN Commission of Inquiry, and most recently, a 2024 UN Human Rights Report found no credible evidence of Israel's claims that hospitals were being used to shield military activities. Other independent investigations and human rights organizations have similarly disproved such allegations in any round of Israeli assaults on the Gaza Strip, including in 2012, 2014, 2019, 2021, 2022, and since October 2023. Yet here we are, 452 days into Israel's genocidal war on Gaza, with 33 out of 36 hospitals damaged or destroyed and 17 left partially functional, 1,057 healthcare workers killed and 450 kidnapped, including the director of Kamal Adwan, Dr. Hussam Abu Safia, who has spent the last few months pleading with the international community to intervene as Israeli drones and tanks encircled the hospital. His arrest and subsequent forced disappearance are not just violations of his individual rights, they are part of a broader effort to silence and intimidate those who stand up for the rights and dignity of the Palestinian people. They are war crimes. Today, Kamal Adwan, the last major health facility in North Gaza, is destroyed and out of service, depriving the 70,000 Palestinians who remain in the area of medical care. Its sister hospital, the Indonesian, was converted into an Israeli military base, another war crime. The destruction of Kamal Adwan Hospital is a microcosm of the systematic dismantling of Gaza's entire healthcare system. When I was in Gaza in May of this year, I personally witnessed the evacuations of Al Najjar Hospital, Emirati Hospital, and Indonesian Field Hospital in response to the impending Israeli invasion of Rafah. 3 hospitals taken completely out of service within a matter of weeks. A 4th healthcare site for which we were providing support, Tel El Sultan Primary Healthcare Clinic, was converted into a morgue after the first tent massacre, and then subsequently forced out of service and eventually destroyed. As we know, the escalation of violence after October 7 marked a catastrophic turning point for Gaza's healthcare system. But Israeli airstrikes, shelling, and intense fighting is not limited to hospitals alone. The primary healthcare system in Gaza has also been completely destroyed. Prior to this Israeli war, Gaza had a well-established primary healthcare system that played a key role in maintaining public health and addressing the medical needs of the population. Primary healthcare was provided by a mix of Ministry of Health, the United Nations, non-governmental organizations, and private healthcare providers. The system offered accessible, affordable, and effective healthcare, in areas of general medicine, maternal and child health, oral and dental health, non-communicable diseases, as well as laboratory, emergency, and pharmacy services. There were approximately 5 million visits to Gaza's primary healthcare centers every year. Today, less than 20% of primary healthcare centers remain functional, and many of these are severely damaged. Some of the remaining centers are unable to provide essential healthcare services due to limited resources, a lack of medical staff, and a shortage of equipment, with access further impeded by the ongoing blockade. Many primary healthcare centers were reduced to rubble due to airstrikes. Equipment such as diagnostic machines, medical supplies, and pharmaceuticals were either destroyed or rendered unusable. Health workers have been left to treat patients in dangerous and unstable conditions. Health workers in Gaza face unimaginable challenges. They're on the front lines, risking their lives to provide care under deadly conditions. Israeli forces killed and injured many healthcare professionals as they treated the wounded and cared for those in need. The destruction of Gaza's healthcare system has devastating consequences for the population. The people of Gaza are in a dire situation due to the lack of functioning hospitals and healthcare sites, and the loss of many healthcare professionals, 2 categories that are afforded protection under international law. The situation is more critical than ever, and the international community must prevent further loss of life and provide much-needed healthcare support. Thank you.